In the past year, poison control centers fielded 4 million calls and treated 2.4 million human poison exposures, children especially at risk.
Absolutely. But when it comes to your prescription drugs, that can really impact all of us, especially the senior citizens. Now the government is trying to get the word out as part of National Poison Prevention Week. Back in December, Raleigh resident Susan Tulloch was diagnosed with a bone infection in her leg.
And I was put on IV antibiotics for 6 weeks. And my sister had to give it to me every day. And we were taught by Liberty Home Care how to do the IV antibiotics.
But Susan still had a slew of pills she had to take every day.
I'm on many medications, approximately 12 that I take for various reasons.
And she's not alone. More and more senior citizens are finding themselves popping multiple pills, but this can be dangerous.
They'll get generic for a medication, for instance, warfarin and Coumadin. They think it's two different medications. It has two different sounding names. They're not sure. It has, a generic and a brand name, and they'll take both of those medications rather than taking just one of those.
Krista Rhodes is a Liberty Home Care liaison who recommends starting by making a list of all your medications, and then
the best thing to do is pack up everything that you're taking. Over-the-counter medications, any old prescriptions, new prescriptions, take them to your local pharmacist. Use one pharmacist. Do not shop around for pharmacies. Go to the same pharmacist.
That way your pharmacist can keep track of what you're taking and tell you if there are any interactions between drugs. But it's not just yourself you need to worry about. One of the dangers associated with having medication in the home is little kids having access to it. That's why it's so important to make sure that you get caps that have that safety lock on it. And then when it comes to storing your medication, you want to keep it in a locked cabinet if you can. But if you don't have access to something with a lock, look for some place that's high and hopefully out of a little one's reach. And if a child does get a hold of a medication, or if you suspect you or someone else has overdosed, follow this advice.
Always call poison control. That's the first thing to do, because some medications you do not want to induce vomiting with.
Very important to call that number. There are medication drop-off sites all this week to help you properly dispose of those old medications.
And to help you find them, we put a link up to that on our website.